Hello, everyone, and thank you for joining us for this session, The New Approach for Therapy Utilization under PDGM and COVID-19. Our speakers are Ana Maria Toronto of Cincy and Linda Murphy and Ronnie Kose of Concierge Home Care. Thank you so much for being with us this morning. A quick reminder to type all questions that you have for our speakers in the chat box, and they will be answering them throughout the presentation. And with that, I'll turn it over to you.
So in a New York Times article published on February 17th of this year, Bill Dombey, president of the NAC, was highlighted talking about therapy and the staffing shortage apparent given the pandemic and challenges going on in the healthcare ecosystem over the past 12 months. Before the pandemic, aging baby boomers were already expected to strain the home care industry and also accelerate the need for additional physical therapy services. Now, many agencies are turning away new patients because of pandemic-related staff shortages, as well as potentially still being restricted from accessing facilities where they're trying to contain the risk and spread of the infection. So what Bill Dombey has said is that essentially the question is, can we get the availability of staff to go up? Especially as the American Physical Therapy Association predicts heightened demand for postponed elective surgeries, such as joint replacements, as well as the growing need for COVID-19 rehabilitation and the imperative to address conditions such as heart disease. So with that, we're going to actually address the issue. And in this session, we're highlighting the exciting intersection of telehealth and physical therapy. We're featuring Concierge Home Care, the agency which has achieved better outcomes for patients and their business by using virtual care to provide ongoing care in a safer, more convenient, and more cost-effective manner during PDGM as well as the pandemic. As a result of using telehealth, concierge therapists are more satisfied with their ability to better manage their patients, treat more patients, and even provide care after hours, in the evenings and on the weekends, and making sure that they're putting their patients' fears, concerns, and issues to rest, if you will, without having to send over a nurse in the middle of the night or on the weekends, or even requesting that the patient go to a medical facility for in-person care. Providing this flexibility to staff not only helps an agencies such as Concierge more effectively recruit and retain qualified staff, but it also increases their efficiency, as the demand for physical therapy will only increase as baby boomers age. Today, I'm honored to co-present with Linda and Ronnie from Concierge. Providing more flexibility will be important as the demand for physical therapy increases with the aging of the baby boomers. According to the Bureau of Labor Statistics, employment of physical therapists is projected to increase 28% from 2016 to 2026, actually much faster than the average for all other occupations, which is really good news, right, for the therapists which are out there, as well as those which are considering it as a potential career going forward. The increased demand for physical therapy is obviously related to the aging of the baby boomers, what conditions that they have that they're going to be more susceptible to health conditions such as stroke, and they may require physical therapy as patients suffering from chronic conditions such as diabetes or obesity, who may have mobility issues. The increasing aging population, along with this rise of chronic conditions, places a great burden of care on home health agencies. And that's only exacerbated by the current pandemic that we're all existing within. Many home health agencies do not have enough qualified therapists on staff, nor readily available for all the in-home patient visits required. And so, for example, a shortage of PTs and PTAs means that an agency may not be able to take on new patients. And that unfortunately limits an agency's ability to increase revenue, as well as it puts them in a not so great spot with referral sources going forward. So moreover, that worsening of patient conditions and patient dissatisfaction can effectively lower an agency's rankings and negatively impact the agency's relationship with the community that they serve and the region that they serve. Therapy visits have been seen historically as a revenue driver for agencies due to the number of visits prescribed. Now that has changed with PDGM. If everyone remembers, prior to 2020, PDGM was the thing, along with staffing, that was keeping up everyone at night from the agency perspective. And then unfortunately, lo and behold, COVID-19 emerged. And those two still are really top concerns for agencies going forward. So let's talk about what virtual care is and how impactful it can be. So here's just what patients and family members are saying about telehealth and how it helps. And we thought it would be helpful to kind of upfront share with you what are the experiences and the satisfaction. And as you can see by the quotes here, what's interesting is that the patients are saying it and their family caregivers, whether they live with them or they're nearby or remote, are more than thrilled with the ability for an agency to provide more touch points more frequently and deliver a lot of interesting content and much more impactful exercises via video as well as messaging. So I'll just read a couple of these to you today. So the second one from the bottom, my family is so happy that I can still get my therapy and no one has to come into the house during COVID. And that's something that, we hear time and time again, is that people are concerned about keeping their home and their loved ones protected as much as possible and trying to minimize any type of visits from the outside. And they know that these visits are critical. So virtual care allows an agency such as Concierge to continue to engage the patient and make sure that their mobility and their ability to restore their independence comes along as planned, if not better than how it would be with typical, in-person only visits. And then let's see what your peers are saying. So what some agency providers at Concierge, as well as other agencies that Cindy works with, what they're saying is that they are really impressed by having this type of technology. And for a lot of them, they, really saw that impact, how critical it was once the pandemic emerged, because it was no longer, oh, this is a nice to have. It turned into, this is a must-have in order to continue engaging and supporting patients. And also, no one sees that this is going to go away post-pandemic. Everyone expects that this is just going to be part of kind of the new normal of how to deliver care from a home health agency perspective. So this is on trend. Applications of virtual care and telehealth have actually had roots already throughout patient clinical care and consultations, according to the American Physical Therapy Association. What it does is it allows physical therapists to communicate more often in a much more convenient manner, and it provides patients with flexibility in the care. Virtual sessions are not meant to blanketly replace in-person care. Instead, they really supplement it, sometimes substitute it, especially if visits are being restricted, and it allows the agency themselves to better leverage available staffing resources and enable their PTs and PTAs to provide services in a greater capacity. So this is all about what we call converting drive time to patient time. So instead of, the physical therapist and the PTA and someone like Ronnie, a director of mobile therapy at Concierge, spending the majority of their day behind the wheel, instead they're actually spending more time engaging with patients, whether it's in person or even more so virtually. And the virtual care model helps home health agencies, especially if a physical therapist is unavailable unexpectedly at the last minute, because no longer does the agency have to look at their roster of physical therapists and determine who's available, can they get to a patient in time, et cetera. But instead, it could really virtually make sure that the care continues seamlessly and on schedule for the patient. And that is so important, because what we all want to do, right, is make sure that the patient remains on schedule with his or her treatment and continues to get up and moving as he or she is required to do, so that their independence and their mobility is restored as soon as possible. So it's interesting that tele-rehab sessions as well as traditional in-person sessions can really be an effective balance. And Linda's going to talk about how kind of cost-effective it has been, as well as how impactful it has been in terms of the care and the outcomes that they have received. A little bit about care under PDGM. So before 2020, the goal was that agencies were more inclined to prioritize better outcomes because we're all moving towards a value-based care model. And therapists are able to help injured or ill patients stay on track with their treatment in terms of the movement, as well as managing their patient more efficiently. So instead of cutting back on services, which a lot of agencies thought they might have to do going into PDGM, instead, agencies saw this as kind of a silver bullet, if you will, to help them continue that care and be much more cost effective with the resources they have, both human capital as well as financial and time, in terms of delivering the care that they need without negatively impacting patient outcomes.
So it's a pleasure to be here today. So I'd love to, we actually started working with virtual care in June of 2018. So we had a little bit of a head start on PDGM. And quite honestly, I was looking at a more cost-effective way to touch our patients more in order to, we had found that we had stabilized with our reduction in rehospitalization rates. And I was trying to see, can I move that needle a little further? Can I move it just a little bit further? And we had done a couple of pilots where we were doing virtual visits with our patients, and we knew, hey, there's a solution here. When you can actually interact with the patient more frequently and identify needs quicker, you could be more proactive in the approach of care and prevent rehospitalizations. So all in all, we started implementing a long time ago, and we now do close to 2,000 virtual visits on a monthly basis throughout our agencies. And not only just from a virtual visit platform, but also our communications from start to finish on our patients. So I'm just going to take you through a moment on our patients that we have here at Concierge Home Care. And we use the application process with Cindy, and we start the patient right from the get-go. They receive a welcome text that tells them welcome to our home care agency. They receive a welcome call when we can by video from their clinical managers. We incorporate our protocols that are throughout our EMR, as well as pushing educational videos to our patients, as well as our day in and day out virtual touches where needed to help prevent and provide better care. We expanded to therapy probably about a year after. In 2019 is when we started playing around with therapy visits. So again, this was all pre-PDGM, and just in a way to figure out how we could cost effectively touch our patients more and get better outcomes. So we deployed virtual visits throughout our territory. We started to use our therapists, and we found some were able to integrate this, a large proportion to integrate with additional touch points and follow through on those days when the patient's not being seen, to ensure that they're following through with the care plan and giving them the additional support that they needed. Quite honestly, we're a company that's only been in business since 2015, so we're kind of in our infancy, but innovation and technology has really been a part of our culture. So as a result, we were early adapters to technology. So for me, it was a no-brainer that virtual care was the answer to PDGM. Lord knows no one expected that we would have COVID on top of everything, but I have to say today that I'm so grateful that we had started the way that we had, understanding virtual care from a quality of care and a value-based purchasing perspective. But also it was the answer to meeting the needs of our patients that were really very frightful in the beginning of letting team members come in the home and allow us to still give them the care that they need. So we have a very robust virtual care program. Our our virtual cares are not just check-ins with our patients, but they're actual visits that have value to them. And I like to say there's a magical moment, an educational moment in every one of those visits that we do. So virtual care is part of our culture. It's really the culture that we're providing to try, how do we care for people who care for people, and how do we get better results, and how do we meet the needs of our community. It's been a great answer also to some of the alternative payment models that we're in. It's been a great answer to supplement with some of the bundle projects that we're in, and also from an ACO perspective. So it's we incorporated all the way through, from a nursing case to a therapy case to an occupational case to a speech therapy case. And the results are there. We're 4.5 to 5-star ratings in every office that we serve.
Now, patients who have or had COVID-19 may have a lot of fatigue, a lot of weakness, a loss of function. They cannot do things that they could do before. They have a lot of respiratory problems and loss of endurance. And because of their comorbidities, some of their other issues are exacerbated. So if you have a person with a previous fall injury, your balance may be affected even more so. So for a patient recovering from any critical illness, not just COVID-19, rehab is vital as they work to regain the ability to perform the activities of daily living. And with COVID-19 hospitalizations, one may assume that unfortunately the patient is pretty much immobile for most of the time, and it's going to center around the patient's safety. So what's important from the physical therapy standpoint is that, patients could also be discharged faster to the home for recovery and receive PT, both in person as well as virtually. But also for some patients who are diagnosed with COVID-19, more and more home health agencies, such as concierge, are actually helping to ease the burden faced by the hospitals by freeing up beds for the most critical patients with severe cases of COVID-19, and making sure that other patients can work through and be supported as they recover from COVID-19, and also as they regain their sense of mobility and independence. So the goal is to make sure, right, that they get back to their normal activities of daily living, working with them to improve measures versus the baseline that they had maybe when they were first diagnosed with COVID-19, as well as even before COVID-19. And it's one thing for a patient to say they feel good, and it's another thing for the therapist to say that they look good, but it's another thing to see that the functional scores have actually improved, and that, the therapist can see someone walking, 300 feet to their kitchen, out their front door, et cetera, without assistance. And that can be so easily done virtually to check in with the patient and see how they're doing on a more frequent basis than just waiting for that in-person appointment to come around, whether it's next week or in a couple of days from now.
So again, from concierge perspective, we were, as I mentioned before, looking at how do we get better outcomes, but how do we get those better outcomes at less cost? That's really where PDGM is forcing all of us to think about the cost and value-based purchasing. We deployed the virtual care because we wanted to continue to meet the needs of our patients and our clinicians. So we needed a way to get the same outcome or better outcome, but reduce the overall cost. So our clinicians needed to manage our patients by outcomes and actually perform overall case management. So how do we look at a case? How can we reduce costs? And how can we touch that patient at least the same or even more frequently? So how else can you accomplish that without virtual care? So coming in again, as I said to PDGM, innovation and constant improving is part of our culture. So as a result, it was easy for us to really become an adapter of that technology. I say easy in one fact, but it is honestly anytime you're implementing clinicians that have been in the home care world for a long time, it's really a new thought process. Even when you think about, I'm sure everyone on this webinar has gone through a huge transformation and even understanding what we can accomplish as leaders working virtually. I don't know about you, but in a lot of our offices, folks were very, they're used to coming into an office, bringing a team together. You have to be side by side. But I do think that with PDGM, it's forced a lot of us to realize how much we can accomplish over Zoom. But Zoom, even in itself, when you're on a webinar, it's not near as effective when you have a name looking at you versus being able to see a face, see the reaction. Take that phone into the closet, show me what's in your refrigerator that you're eating today. Show me the prescription on your medication. If you're on an IV and somebody's got it's beeping, to be able to take a phone over and go, let me see the where exactly we're having a breakdown, and imagine being able to prevent a nurse from driving an hour or an hour and a half in some of our rural areas after hours because an IV is beeping, where you're able to walk a patient through troubleshooting and getting that IV up and running. So the cost savings, the employee satisfaction for the nurse that's on call, and the patient's satisfaction with having their issues resolved immediately rather than waiting through all those other processes that we normally would have gone through. Again, it's when we have a moment and we have a glimpse into the patient's life and we can help them accomplish their goals right at that moment. Honestly, I think we've also been a stronger provider in the community because we have to do everything for our patients, and it's part of what we do. But virtual care is an expectation of what we provide to our patients. It's now become part of our culture. It's part of our expectations. When we onboard our patients, we're super excited when we do our welcome calls to let them know we use technology to try to enhance the care that we're providing to them. What's really nice is we can use a smartphone, we can use a telephone, we can push text messaging. We have lots of different options. And I think we can all say the number one pushback I'd initially get from folks is that, oh, our elderly generation and population, they're not familiar with technology, they can't do this. Well, I'd like to say the majority of our population, and I look at my mom and dad and I look at our patients, they're all on tablets or on smartphones or using text messaging ways that they've never done. My girlfriend's 99-year-old grandmother was texting her when I was in the car with her yesterday, and whoever thought that would be possible. But we are moving to this new world, and very quickly moving to a world where our baby boomers are adding to this generation, and technology is not just a benefit, but it's an expectation of those folks, and immediate responses to their needs is an expectation, and virtual care allows us to meet those needs.
Linda had mentioned the challenges of sending a nurse out an hour and a half across a rural area. And that's something that a lot of agencies face, as well as sending out nurses, especially when they're bad weather. Right now, we're recording this webinar presentation, and Texas has unfortunately been truly impacted by horrific weather and conditions that really leads to somewhat of a shutdown in care unless it can be delivered virtually. So home health agencies, which serve rural communities, really face unique challenges in providing accessible and impactful care for the patients across huge geographical distances. Barriers to providing quality care include such that nearly half of agencies only cover partial counties. They are not necessarily licensed by Medicare to serve the whole county. So they only have the resources and staff and capacity to cover part of the county. And as a result, some areas actually have gaps in home health coverage for rural Medicare beneficiaries. Nearly all share that, like what Texas is unfortunately going through right now, bad weather, poor road conditions increase the already long time staff spends traveling between home visits. And over half reported difficulties in staffing at least one of the therapy services. So as a result, administrators are not always able to staff according to the patient's need, as well as accept referrals coming from institutional and community sources, because they know that they might not have a therapist readily available to provide care. And of course, some agencies do contract with others outside of their own agency to augment the small caseloads that they have. But that also means somewhat of a breakdown in the brand that the agencies have and their reputation in the community at times, as well as not always being able to depend and guarantee full-time work to those people that they contract with. So providers in rural areas really turn to technology to kind of cover the geographical distance and address those barriers to care for the patients that they serve so that they can really augment and a lot of times replace in-person visits and give patients the timely and quality care that they need and that they deserve.
So honestly, out with the old, we speak about out with the old and in with the new, so to speak, but just to kind of give you a couple of ideas about ways that we have been really fortunate to use our new technology to a benefit. We are actually able to push even monthly educational messaging to our patients, to our current and our past patients. That goes along. This month, it's February. We spend a lot of time doing education with our patients on cardiac disease during February, and we can push text message education to our patients as well as video. We also, we live in Florida, so in Florida we get hit with a lot of hurricanes, and I can tell you it's an amazing situation when I know I can say, let's send an assessment to all 3,500 patients that we currently have on census to see who's going to have any difficulty, from an emergency stand and who's going to what clinics. But we can send out assessments with questions and feedback. When COVID came around, it's very nice for us, even as we admit a patient, we can send them, push them an assessment to ask them questions. Are they having any signs of symptoms? Have they been around anyone? Just to give us some additional education. Prior to discharge on a patient, we can send an assessment to a patient to determine, have you had any recent changes in the medications where, is there any needs that we haven't met? So it's when we talk about virtual care, it's not even just the virtual care that you're doing in the one-on-one education and visit that you can do with a patient. To me, virtual care encompasses a communication platform that we embed in the protocols and the care delivery from the start to the finish and even beyond with our patients. So it's just critical that we think about patients in the continuum, especially our elderly patients, that they're coming in and out and flowing through our healthcare world with multiple comorbidities, that we're able to help them along all the areas and push education and make them feel like they've got somebody that they can go to and get the quality and the outcome and the answers that they need. So it's been a very interesting path for us as we have watched virtual care evolve from a therapy perspective. And I think really as we move towards, and Ronnie's going to get a chance here to speak and talk to each one of you about exactly what that's been. It's been a wonderful experience for me to watch the video interaction of Ronnie as with some of our bundle projects, was able to take a total knee patient that typically would have had anywhere from, in our world that we live in now, 6 to 8 therapy visits. In a past life, we all know that would have been 18 to 20 therapy visits, but now be able to do that in 3 in-person visits and 3 virtual visits. We're really changing the world we are and the expectations, but we can accomplish a lot of the same goals that we've done much more cost effectively with much better patient satisfaction.
Yeah, I think the physical therapy approach, I get fired up when we get to do these presentations together, Linda. It's been a wild 2 years, and obviously a lot's happened. And as much as we prepared for the payment model changes, that the pandemic hit, and we're feel so blessed that we were kind of prepared in this sense. But I remember sitting down with Linda and saying, how can we get therapy involved? How can we get telemedicine incorporated? And I think if we look back over the last 2 years, and we can confidently say that, telehealth in nursing and in therapy, it's totally embedded in everything that we do. It's not just something that we're trying, it's something that is totally incorporated with everything. And like Linda mentioned, we were able to take that first patient and say, 3 visits in person, three visits virtually, you met all your goals. And when we built a nice roster of patients that we had done that with, we rolled it out to the entire company. We got a little pushback first. The therapist said, I don't know if I can do this. I'm a physical therapist, right? I want to do physical work. And what we've been able to do is really, as we thought we'd lose visits and we'd have to spend more money to provide care, we've been able to get the same outcomes with less physical visits. And we're seeing that our therapists are really incorporating this in a confident manner where they're able to replicate that same therapy. I can't tell you how many times I've gone into a home the day after the patient's been out of the hospital. They've had tons of people there talking to them. They've got a ton of information. And I do my evaluation thinking they're going to have some kind of carryover into my next in-person session. And I get there on day 2 and they don't remember anything, right? And so we have to start back over and see, can we get this compliance? Can we get them to understand what we want them to do in a time that's probably one of the most stressful times in their life? So, we've been able to follow up that very next day virtually and say, hey, Mr. Smith, how did it go with this exercise today? And really review that and get those extra touch points that Linda mentioned. So it's really changed the way that we provide care. We used to have protocols with total hips, total knees, and other diagnoses. And using Cindy and telehealth has really allowed us to elevate those protocols and elevate the touch points and the amount of care that we have. And with COVID, we're also doing outpatient therapy a little bit. It's fully reimbursable under Part B now, and we've incorporated that with some of our staffing too. So, we've been able to really innovate, and that's still a work in progress in how we do those things. But like I said, concierge has really stepped up with the innovation piece, and telehealth is top down. It's part of everything we do.
Oh, that's me.
I was gonna say, Linda, I could talk if you want me to, but I'll let you drive this one.
So, I love webinars. So keys to success. So honestly, our patients, I do find, are getting excited now. And I have to use an example. I was sitting in one of our offices, and I was listening in the background as one of our clinical managers does wonderful welcome calls with our patients, and when had the opportunity does those virtually. It's an amazing opportunity for that clinical manager that manages the care of her patients to actually get to see that patient in person. And the other day I heard a patient calling in through Cindy, and it was a virtual call, and I could hear her. I had to get out of my chair and go watch, because here was the lady with her little tablet trying to show our clinical manager her leg where her swelling had gone down and her wound was much better. But she was so excited and calling back to the clinical manager because she wanted her to let her know how great our nurse had done. And she was so excited. Her legs had never been this small before, and that she was going to be able to go to the store for the first time in 6 months. And it was just a beautiful thing to watch. But I use it because it's, one of our values is care. Is caring and being able to care for our staff and care for our patients. And I think this really helps culturally on both ends. It cares for our staff to allow them to take better care for our patients. It allows team members to be able to provide good care in a time where we might have folks that are on quarantine from COVID and be able to touch patients. We have instances where staff members may, we have a call in, and I don't know if everyone else is like us here in Florida, but staffing is becoming more difficult and more difficult from a healthcare perspective. So when you do have a call out, who's going to see those patients that you're missing? And when you can actually do some of those visits virtually, in place and make up, you can still not miss a beat. As well as, quite honestly, capture things that we might be missing when we're doing in person. So I'll talk about our therapy cases. If we have a therapy only case, we typically request the doctor for a virtual nursing care the day after the therapy evaluation is completed, and we do an entire medication reconciliation. And it's amazing when you are concentrating virtually with a patient just on medication management, what someone could miss because they're in the home dealing with all the different factors that they're dealing with when they're handling that patient. So you would be really surprised to see how much our virtual care nurses pick up on that our other nurses that are in the home are actually capturing, because there's so much to be done on a start of care visit or some of those follow-up visits. We also do a call every Monday where we review exceptions during the week of where we've actually prevented a patient from going back to the hospital. So it's amazing. We do tuck-in calls on Fridays. We do visits on the weekend for some of our commercial insurances to do case management, because we know in those first 2 weeks are so vital post-discharge from the hospital setting, when patients are a little more acutely ill and we're trying to keep them out of the hospital. But it's just a great way to augment the in-person care that we're doing and get the results that we need. And I'm sure most of you, like myself, I can't tell you the last time I was in a doctor's office. So I'm very fortunate to have a doctor that does telehealth visits as well. And anytime I need them, I set up an appointment, and in 5 to 10 minutes, I have the answer that I need or the prescription that were needed. I can't imagine having to drive and sit in drive 45 minutes to a doctor's office, sit and wait for my turn, and then go home. I just don't have that kind of time anymore. So our patients are really, when you ask them, and when we do our customer our satisfaction surveys, they're really thrilled with our virtual care visits that we do with them.
And Linda, I'll just step in really quickly because I almost started reading this slide earlier anyways, but looking at getting your patients excited, and we've talked about, and everybody talks about, how can the elderly population, that senior group, can they get behind technology? And I think that we've been able to implement some protocols to really get these patients excited and keep them excited for that virtual contact. And I think a lot of that has to do with the way that we introduce it to them and the way that we actually make each session a quality session. I know that if we go in there and we just say, hey, we have the option, we can do telehealth if you want it, it's not that big a deal, we're not going to get a lot of buy-in. But we really make it a point to say, we've got a VIP connection, we've got this direct line to your care person on our telehealth team that you can access at any time by opening your app and clicking this button. And what we'll do is in the home, we'll actually just show them that person. We'll introduce them and say, I'm Ronnie, your in-home PT, and this is Lauren, and you can call her at any time and she's ready for you. And so we really get them excited. But when we do those follow-up visits, we're always giving them that quality interaction, that quality improvement from their previous session that keeps them engaged and keeps them wanting more and seeing that value. So no, it's been incredible.
So there's the downside of not adopting virtual care. And it really means that the agency is not going to be set up to care for its patients, address their questions and issues in a timely manner. Also, they're not able to continue reaching out to them and engaging them throughout the episode of care above and beyond in-person visits. So the motivation for the patients and their family caregivers to remain engaged and adherent and compliant kind of is perhaps diluted a bit because they're not getting the constant reminders and reassurance from an agency that truly cares for them. So much like Concierge said, they position virtual care as a VIP service that makes every patient, every family member feel like they're truly getting someone who is on their side, behind them, supporting them every step of the way and practically every minute of the day as well. And this, of course, all has an implication to what happens to an agency's top line and bottom line. So with virtual care, agencies are able to position themselves for growth by being able to increase their daily census, taking on more patients, and being more productive with the limited staff that they had. As Linda alluded to, staffing remains a huge challenge within the state of Florida, and even Home Healthcare News recently highlighted that staffing is a top concern for both home health agencies as well as hospice agencies. And virtual care really allows an agency to accomplish more with less by better utilizing the talented staff they have, as well as positioning themselves as being innovative and forward thinking, and able to attract staff from other competing agencies.
So as we see here, these are some of those examples of use cases where we can do welcome messages, we can do appointment reminders. My clinicians can actually in 5 minutes send out text messages to all their patients for the next day and let them know what time they'll be seeing them, or give them a time range. We usually do a 2-hour time range between 12 and 2. We can actually bring in specialists. So we have the ability to bring in a wound care specialist with a clinician while they're in the patient's home. So they can get better answers and make sure we are on the right path. We can do respiratory therapy. We can do dietitians. So it's really not even just a matter of doing that virtual care, but being able to link in a physician practice, or in some of the bundle projects that we have, a physician on a patient, so that we can get an answer right away and prevent that rehospitalization. A respiratory therapist for a COPD patient or something else that we have on, or a dietitian to work with that nurse in that home with that patient as they're developing a complex care plan in regards to that. Palliative care, we have a couple of pilots going on now with palliative care physicians too, that allows us to operate and have better answers for our patients and bring those physicians right in there. Transitional care, I can go on and on and on with all the different ways that you can enhance the care delivery that you're doing, utilizing technology and using both virtual care and the communication platform that we use, from a text messaging, virtual visits, as well as assessments, and getting answers a little bit quicker. It's just, I know I mentioned earlier, and I can remember the old days when we had a hurricane and how many people I would have sitting there on telephones calling each and every patient just to make sure that they had water, where were they going to their shelter, what was going on, all of those pieces. And now in moments, I can send out an assessment and get those answers back very quickly.
Here's a couple examples of messaging templates that could be sent out to the census. And as Linda said, obviously there's ones where it's the emergency preparedness, so the hurricane planning and whatnot. But also there's messaging that should be customized to your patient's condition, as well as the protocols of perhaps the referring physician, as well as your agency. And typically it starts off, as concierge does, with the welcome message of making sure that someone is welcomed formally, if you will, via text or email by the agency and by the provider, the clinician, the therapist who is going to work closely with them. And you can see that a lot of these messages really serve as kind of thoughtful reminders, and it helps people remain adherent and compliant to what they're supposed to do, what medications they're supposed to take, the exercise, the nutrition guidance, etc. But also in the case of a lot of patients, especially in COVID, it helps with the SDOHs, right? It's that whole idea of how can we help address the feelings of loneliness, isolation, stress, anxiety by patients who are living alone or living in facilities, and truly their access to the outside and to visits, even from family and friends, have been severely restricted. So this is kind of that, helping hand, that guiding force that the agencies are doing, that isn't just about one's physical and mental health. It also has that emotional and social support as well through the Cinzy platform. And with Cinzy, we recognize that, there's a significant patient population, which is what is considered the limited English proficient population, meaning that a lot of patients prefer to speak in a language and communicate in a language other than English. So it's really important that your messaging, your communication is relevant to what the patient truly wants to hear and how they want to hear and how they want to read it. So we have translators, we have interpretation, so that in a virtual visit, quickly an interpreter can be brought in on over 200 plus languages and make sure that the patient understands what's being asked of them, reinforces the messaging for the clinician and the therapist involved, et cetera. And then from a messaging standpoint, all the messages can be pushed out to the patient as well as the family caregiver in the language that he or she prefers or primarily communicates in. So here's a whole host of benefits, and we covered a lot of these. What I would say is probably something that agencies really want to highlight with their referral sources is that they are minimizing the ER visits and the readmissions. It's really, recognizing the critical role that agencies play in reducing the burden on our hospitals, but also reducing the cost in the healthcare ecosystem in general. And we've seen all the reports that show that, home healthcare it's impactful, but it's also more cost effective in general than what could happen from the SNF as well as the hospital side of things. So we're seeing more and more that home health agencies such as concierge are adopting the hospital at home and the SNF at home models, and virtual care plays a role in making sure that the patients are getting that higher level quality of care and that the clinicians are able to deliver care at the highest level of their license by using virtual care in addition or instead of in-person visits. So how do you measure success with this? Measuring success, a lot of it has to do with the satisfaction and the impact that you have. Sometimes it's, as you can remember from the very beginning of this presentation, it's just the joy that the patients and the family caregivers have in terms of feeling that someone is looking out for them, someone cares for them, someone was thinking ahead to make sure that, especially during COVID, they can continue to receive the therapy that they need and that they deserve. And then there's also the side of things where it's all about the staff. And as concierge's mission points out, it's, caring for the people who care for people. And virtual care helps in that regard. Everyone talks about the triple aim of healthcare, but that quadruple aim of healthcare is all about staff satisfaction and making sure that your staff remains happy, productive, part of your team, and willing to do and able to do everything they can for the patients and the communities that they serve. And that really helps achieve that quadruple aim, that fourth aim of healthcare, if you will. So we talked about the virtual care platform, and at Cinzy, it's more than just virtual visits. A lot of people think that telehealth equals virtual visits, and that means video. And for some agencies, that's where they get started. That makes sense given the use cases and the opportunities that they have. But I want to just quickly give an overview of what else is available on Cinzy's virtual care platform. So condition management is all about messaging that reflects the clinical pathways of a patient's condition. So they may have multiple conditions, they could have chronic conditions, comorbidities, et cetera. And maybe it's once a day, once every other day, a couple times a day, the patient will receive a message that is truly designed and is tailored to what is going on in his or her health, and importantly, reminds them about the need to be adherent and to comply to medication, nutrition, exercise requirements, as well as if they have any concerns, they can reach out to the home health agency easily with the click of a button. Secure messaging is important from that HIPAA compliance standpoint. So Linda talked about, the patient experience of wound care. And that's one of the, biggest examples of when secure messaging comes into play. It's very helpful because most agencies have one, if any, wound care specialists, or just a smattering, a handful of wound care specialists, which are scattered across a state or a region, and they can't address every patient every time. And with secure messaging, the patient, as well as the clinician who's helping take care of the patient on more, say, day-to-day level, if you will, they're able to, reach out, send them photographs back and forth. It's encrypted, it's safe, it's secure, it's immediate, and immediately someone can give them advice as to what they should do next, and really assess how that care and how that wound is healing, if you will. Speaking of assessments, on the right-hand side, Linda had talked about how her agency pushes out assessments within minutes to all of their census. And you can do that in terms of any preparation, making sure people have what they need on hand for a forecasted emergency, such as a winter storm or hurricane, et cetera. But also you could send out assessments based on the condition. And this allows your agency to check in with the patient and virtually get a sense of how they're doing, if they're on track with their meds, what they might need, so that you have that information and can potentially change the care plan immediately, or at least ahead of the next visit that you've done. And last, but certainly not least, is remote patient monitoring for RPM. RPM is critical for especially patients with chronic conditions. And it enables hospitals to really discharge patients in some ways faster, knowing that they're going to go home with a home health agency that is going to monitor and manage them on key measures. And if something is out of line with, say, perhaps the ratio or the range that it should be, those measures, the agency is immediately flagged. So meaning that there's a dashboard, the clinicians, when they're on the road or they're in the office or whatnot, they could look at their smartphone, their tablets, their laptops, quickly get a sense of, okay, how are the patients doing? What's coming in from a glucose level, blood pressure, blood oxygen levels, et cetera. And something turns yellow, and that's the immediate alert. And they can reach out to the patient as to if they want to have another reading, if they want to ask some questions, and if they determine if a more immediate intervention is required. So RPM is, such an important, valuable, vital part of virtual care that many agencies are using to truly round out that virtual care offering that they provide to patients. And to just wrap this up, a little bit about Cinzy. We're a technology company. We're focused on healthcare. We work with organizations such as Concierge Home Care, who are thinking about their patients and what's best to do for their patients from a post-acute care standpoint. So our user interfaces, whether it's from the administrator, the clinician, the provider, or the patient and caregiver side of things, is very intuitive. It's easy to understand. It behaves like an app would for anyone. And the goal is to make this, care and this delivery of care as seamless and streamlined as possible. So it really complements the workflows that your agency already has in place. I want to thank both Linda and Ronnie for sharing Concierge's experiences and insights regarding the use of technology, specifically telehealth and virtual care in physical therapy, to increase referral sources, to strengthen patient engagement, and most importantly, to improve overall outcomes. Please feel free to reach out to us with any questions. We're happy to help, and we wish you well in the year ahead.
Thank you.
Thanks.
All right, thank you all so much for that great presentation, and thank you everyone for attending this session.